Hi there, this is Jordana from Deep Physio. Today I am going to do a video on Piriformis Syndrome. So Piriformis Syndrome is something we see quite a bit in the clinic, and sometimes it's misdiagnosed as sciatica. Sciatica that comes from the back and then radiates down the leg, whereas with Piriformis Syndrome, it can give the very similar symptoms going down the leg, but it's actually coming from the impingement of the sciatic nerve within the deep muscle itself. So the piriformis basically attaches onto from S2 to S4 down here on the sacrum. It comes across thicker and then comes into a band and attaches onto the greater trochanter of the hip. So if the hip bone was in here, it attaches into there. What the piriformis does, along with the other deep muscles of the hip, is it basically compresses. It's like the rotator cuff of the hip muscles. So what it does is it actually compresses the hip bone, which the head of the femur, into the socket. So when those muscles become really tight, what they can do is they can have a torque on the pelvis, and as well it can basically, they can laterally rotate the femur. Now, with that said, if that muscle becomes really tight, the sciatic nerve that comes out from the nerves here runs down through and then goes down the leg. The piriformis muscle can actually compress the sciatic nerve and give a lot of sensation down the leg, pins, needles, numbness, pain. More so when somebody sits down for a long time, they can really feel it. It's commonly seen in people who do sit or people who are very active, like your runners. One relationship we see here at Deep Physio using a protocol called neurokinetic therapy is when we see one muscle that is actually facilitating or overworking for another group of muscles. So with the piriformis, with the other deep rotators that we haven't talked about today, they can actually come in, and when they start to get tight, they actually compress the hip in the socket. So what that does is it basically brings the hip really tight. So a lot of people who have a tight hip capsule, they have difficulty coming internal rotation and external rotation of the hip. What those muscles then do is they actually switch off the big glute max muscle. So the glute max is what we use when we extend the hip when we're walking. So we can see that as a relationship that can basically cause a lot of pain. So what we like to do is, if we find that relationship, we release the piriformis muscle and the deep rotators, and then we try to activate the glute max muscle to try to change that relationship that's going on, which will then therefore release, hopefully, a lot of that pain that people feel down their leg. So today, that's what I'm going to kind of show you a couple things. So first off, we use a lacrosse ball. First thing you're going to do is you're going to kind of sit on the lacrosse ball, and everyone will know if you have a tight piriformis, you will feel it right inside the glute. So what I like to do is I just basically, it's quite tender, so I lift my hands up and I kind of find that spot. And what I do is I just kind of friction back and forth over the muscle perpendicularly. So if the muscle, like I was showing you on the model there, if the muscle is running lengthwise, you're running the ball up and down it. So you do that for about 1 to 2 minutes. I won't do it today, but you can also use the foam roller. Next, a really nice piriformis stretch. There's a couple different ones, but this is one that I like to get all the deep rotators of the glute, is I lay down and I bring the leg up, try to keep a nice neutral pelvis, and then I just take the leg over to the side. So I'm stretching the whole lateral components here, as well as the deep glute. And then I'll have some tension here, and then in my foot, I kind of just push against the band and create a contraction, the belt, and then I basically come over and I stretch it a little bit more. So I hold that for about 30 seconds or so, push, and then release off again, 10 to 20 seconds, in total 30 seconds. And then I come down, and lastly, to activate now the glute max, I come down and I just basically, to get the glutes going again, I just lift up, keeping my core engaged. Again, I'm getting glute. Now, if I want to do both glutes, then obviously I'll just do bridges up and down like so. If I want to isolate the one that I'm trying to work on, I'll put the pressure into the right foot, my core is engaged, and then I just basically start to float up and lift up the other leg. Now, what we don't want to see is this dropping down of the pelvis. You want to really try to keep your pelvis square so your glute is working, and then you're bringing it all the way back down. And you might do that, say, about 5 to 10 times, depending on your strength. The minute you start to get too weak and you start to lose form, then that's when you kind of stop. So for any of you guys who have that deep glute pain, sit a lot, radiating down the leg, this is a great exercise, kind of little set to do before you work out or before the start of your day. If it's not getting completely, or if you're not getting completely rid of your symptoms, then best come down and get an assessment and see if there's anything else going on. Thanks.